Good morning, esteemed judges and fellow participants. My name is Prilian Akbaril, and it's a privilege to present our paper on behalf of our group from ARS University. Our team members are Dana Rizky Afina Rama, Fitri Utami Dewi, Prilian Akbaril Satriyo Pamungkas, and Rian Andriani. The title of our presentation today is Patient Safety Culture Among ASEAN Countries. Patient safety is critical. It's about preventing errors and injuries, and its foundation rests on three key pillars: effective communication, non punitive reporting, and a supportive culture. In the ASEAN region, patient safety is officially a priority under the ASEAN Health Cluster Work Programs for 2021 to 2025. Despite this regional focus, there is a clear gap. We need a current integrated review to understand the precise status, primary problems, and common challenges across all 10 member nations. The main objective of our study was therefore to describe the implementation status, primary problems, and consistent challenges of patient safety in Asian countries. The expected benefits is to provide a comprehensive regional overview highlighting both the strengths and weaknesses, which can then be used to structure more effective and targeted regional solutions. Now let's look at the methodology used to conduct this literature review. We sourced our data from four major academic databases: Google Scholar, PubMed, ScienceDirect, and Scopus. Our inclusion criteria were highly specific. We only included original research articles. The articles had to be full text and open access. Crucially, the publication year had to be recent from 2021 to 2025. And finally, the content must specifically discuss patient safety implementation in any of the ASEAN countries. We utilize a specific set of keywords. We combine patient safety and hospital and combine this with the names of all 10 Asian countries. This process led to an initial pool of 30 articles. After an initial screening, we discarded 6 articles for being off topic. We then screened the remaining 24, discarding 4 more that did not meet our strict inclusion criteria. This rigorous screening process resulted in a final sample of 20 articles that were analyzed for this review. Our analysis revealed several positive findings and 3 major challenge categories. Looking at the positive findings, we identified key strengths in the region. There is strong teamwork within units, with one study showing up to 91.67% agreement. Hospitals also scored highly in dimension related to organizational learning. In one country, Brunei Darussalam, effective pharmacy involvement in medication classification was noted as a strength. However, the challenges consistently fell into 3 categories. Challenge Category 1: Human Resources. The main issues are staff shortage and high workloads across Vietnam, Malaysia, Thailand, and the Philippines, which subsequently led to stress and burnout. Furthermore, we noted a competency issue, such as the lack of supervision or mentoring for new staffs and students in Brunei Darussalam, contributing to errors. Challenge Category 2: Facilities and Procedures. We found severe non-compliance and inconsistency with standard safety procedures. For example, the implementation of the 5 moments for medication safety was very low, with only 5% implementation in Cambodia and 16% in Indonesia. Additionally, many countries like the Philippines and Vietnam still rely on ineffective manual incident reporting systems with minimal use of ID. Challenge Category 3: Management and Culture. Here, we see a weak management support demonstrated by low specific budget allocation for patient safety. Only 21% of Philippines public hospitals, for instance. Most critically, there is a pervasive blame culture. A punitive environment encourages reporting, as evidenced by 76.9% non-reporting rate in Vietnam. This lack of non-punitive response, coupled with non-proactive leadership, significantly hinders the development of a strong safety culture. The discussion confirms that the single largest barrier to patient safety culture is the punitive barrier. The non-punitive response to errors dimension consistently scores the lowest, sometimes as low as 17.65%. This blame culture stops honest reporting and prevents organizational learning, making it the core weakness. To address the priority issues, namely staff shortage, the punitive culture, and lack of management support, we propose integrated solutions. For human resources and culture, we must increase recruitment and implement effective workload distribution. and critically implement strict non-punitive reporting policies with confidentiality and a focus on systemic improvement, not blame. For management and procedures, managers must be actively involved and allocate specific dedicated budgets for patient safety. Finally, there is a clear need for regional standardization of safety procedures and regular external audits to ensure consistency across the Asian member states. In conclusion, consistent change in human resources, procedures, and management demand immediate integrated solutions. We urge hospitals and government to immediately prioritize staff well-being, non-punitive reporting system, and dedicated patient safety budget allocation. Before closing, we must acknowledge the limitation of this study and suggest avenues for future research. The main limitation of our literature review is its reliance on secondary data published within the 2021 to 2025 period. For future research, we suggest two key areas for primary studies. First, studies should investigate the specific link between occupational stress or burnout and patient safety culture. Second, comparative case studies of successful non-punitive systems in healthcare could be invaluable to guide regional policy. Patient safety is not a program, it's a culture, and it's the responsibility of every individual in the healthcare system. Thank you all for your attention and thoughtful engagement. We hope our findings provide a solid foundation for building a safer healthcare environment across ASEAN. Thank you.